Cheryl Dalton-Norman is the co-founder and president of the Nurse First organization, Conduit Health Partners. They partner with health systems, health plans, and employers nationwide to improve care and access for their patients and employees. Welcome to the show, Cheryl.
Thank you, George, for having me. I'm really happy to be here today.
Yeah, I'm excited to have you on. Tell us a little about your personal life, some more about your work, and why you do what you do.
All right. Well, first and foremost, I'm a mom and a grandmother. I have to start there with 3 kids and 6 grandkids. I've been a nurse for 41 years. I'm married to my high school sweetheart, and I'm a healthcare executive for a long time, and one of the founders of Conduit Health Partners that was really founded to help drive access to healthcare because I see healthcare access as a real issue across our country, and we experience it really regularly, both for ourselves and others. So that's really what Conduit is all about, trying to help folks navigate that.
3 kids, 6 grandkids, married to your high school sweetheart.
Yeah,
That is awesome.
yeah. 39 years married.
39 years. Well, there's a podcast there also for a future date. All right.
Yeah.
So you were a practicing nurse?
I absolutely was. I worked in labor and delivery, the OR, critical care step down, led emergency services. So really familiar with healthcare for many years and have really seen the transition of healthcare over the years.
And from the outside looking in, which is my perspective on it, well, I don't know what the biggest problems are. I hear about it takes a long time to see a doctor, and when you get to see the doctor, you don't get much time with them, and it's tough to share information, and systems don't talk to each other, and it's bureaucracy or it's just too big. I don't know what problems that you saw.
Yeah. Well, what I see and having been in it for so long is that it's complex. And you would say, oh, well, I'm a college educated individual. I can, I'm a leader in my community. I'm a parent. When it comes to health, it is not that simple. So you tie complexity with anxiety and illness or concern, and you have a recipe for people either giving up, getting frustrated, or just not getting what they need because sometimes we don't even have the language to ask for what we need. And so, one of the things that we do within Conduit is through our nurse triage solution, especially, we answer questions for folks that they might almost feel embarrassed to ask. We help people get the things they need because they literally do not know how to get it.
That makes so much sense. Um, just because well, hopefully I don't interact with the healthcare system that often, but when I do, why would I be able to articulate and advocate if I had never done it before? So that makes a lot of sense.
Yeah, I mean, if you sent me to a nuclear power plant and said, Cheryl, go in there and, figure this out and, see how you can, make sure your community is safe. I have no idea. And and healthcare, we had a situation not too long ago where we had a wife whose husband had cancer. And it was a weekend and they had run out of his pain medications.
Eesh.
Okay? So it's the weekend. It's at night. And how do you navigate that? How do you get what you need? How do you get the refill? How do you get it filled? And so for us, where we feel like we're able to bring a lot of value to people is our nurse knew how to get hold of the on-call doctor, how to get that refill, how to call the pharmacy, make sure they had it, make sure they were going to be open and get that person all, here, go this place. They will have it for you. And that's really, it shouldn't be that hard, but it is that hard.
But not anymore.
Well, not when we're helping you, it's not. But, it's challenging.
Oh, for sure. For sure. I can think about it for myself. If I were that person who my prescription ran out, and that would be awful for me, it would be even more awful if I was caring for somebody, and all of those things, the complexity and the illness and the anxiety that would come along with that would be extreme, and it would probably get me very upset. So I appreciate that. So when did you go down the road of founding Conduit? Tell me kind of about the origin story and how it's going.
Yeah, yeah. So having been a nurse for 41 years and working in a variety of different aspects within healthcare, one of the leaders that I work with, John Starcher, who's the president of Bon Secours Mercy Health, um, came to me and he said, access is a problem. We need to be sure that patients have the access they need and that it's an easy button, that they're not struggling to get in to our care locations. So what I did was kind of look at some of the things that I had seen in the for-profit healthcare world, in a variety of different places in the faith-based healthcare world. And we started with a transfer center just to make sure that people, let's say you were in an accident in a rural part of the country and you needed a really high trauma center level of care. So we help navigate people from, rural areas for acute care to trauma centers, places where they can get that kind of care. And from that, we really expanded into nurse triage and virtual kinds of nursing because what we found was it's the day to day that is often really a challenge for people. I've been on the phones listening to our nurses when a young father was calling. It was midnight when he was making the phone call. And he was like, I think my baby has a temperature. The baby was wrapped in multiple blankets as the nurse went through it. And I don't know how many times this poor gentleman had been taking his baby's temperature, but it was a lot. And, sometimes you just need somebody to go, okay, well, let's unbundle that baby. Is your baby eating? Is it doing, and basically help someone calm down, help them feel safe. And I loved this nurse that's on our team because she said, you know what? If in an hour you need to call me back, we can talk again and it's okay. So, access for support, and people who live in rural areas, it's a challenge. To even get, you could be an hour or two away from the closest care provider. So you really need somebody who, from your phone, can talk you through the challenge that you're seeing that you have. So it really started from that, and we've just grown and expanded, serving different organizations, really from coast to coast, from South Carolina to California, and north to Wisconsin, and south to Florida. So we're all over the place because healthcare needs are consistent across the country, whether you're in a big city or a rural area. People need help and support.
I suppose that is a silver lining to the fact that we all need health and support. The needs that I have in Arizona are probably pretty similar to the needs that people have in Iowa and Connecticut. So,
Yeah. Yeah, the resources you may have could be different, but the help you need is probably going to be pretty consistent. So, yeah.
so is this does Conduit replace my existing coverage, or is this something that goes on top of it or alongside of it?
It really goes alongside of it. It's an enhancement. For example, we have a large healthcare client that's based in Texas, and we serve all their physician practices as an adjunct to the scheduling service. So if you call in at, you know, 7 o'clock at night and you're like, well, I need to talk to the doctor. Well, maybe you do, but maybe you need to go immediately to the emergency department. So we get those calls. We have folks who take those calls and get them immediately to a nurse. And basically, we ask a few questions. Sometimes we're able to say, you know what, unwrap that baby and let's check back. But sometimes we go, you're on this medication and you feel this way, we need you to call 911 right now, or if you're not able to call 911, we'll do it for you. and get them to immediate care. Because typically what we see is the biggest challenge for folks is not 8 to 4:30. It's after the offices have closed.
Hmm.
It's, during those middle of the night hours when folks really need that kind of help. We've had a triage nurse help a dad deliver a baby on the side of the road.
Wow.
So, our nurse was connecting them to their care provider, and all of them were on the phone together at the same time, and a great outcome.
That is a call that I'd be fascinated to listen in on. Sir, you need to calm down. Like, I'm not calm.
No, and our nurse was a male. We have a lot of male nurses, and he was so calm. He was a dad, and he was just talking to the dad. He's like, I'm gonna get your provider on the phone. I'm with you. And they're talking through it, and a little bit later you hear the baby.
Amazing.
It's a nice thing.
I I imagine that this was not an easy thing to stand up and actually get moving. I imagine there's regulatory hurdles. I imagine that your nurses need to have an understanding of the coverages and how the payment works and all that.
So we have no, we never ask about coverage, and there is no payment for our services. Our clients are paying us, so our customers. So if we're serving a health plan, which we work for payers, we work for health systems, we work physician practices, for federally qualified health centers, we work for employers, we work for a lot of different types of organizations. So the caller never pays us.
Hmm.
There is nothing between the caller and immediate access to a nurse. Now, if they're calling to schedule and then get to us, they've talked to a scheduler who goes, "Oh, we need to get you to a nurse." But most of the time, it's a direct line straight to us, to a nurse, without regard for payment. And from a regulatory standpoint, interestingly, the United States, I'm not sure how familiar you might be with nursing licensure, but there's a compact of states across the country who go, if you've got a license in Tennessee, you've got a license in Ohio and South Carolina and Texas. But then there are some states that are not a part of that compact. So our nurses, have to get licensed. If they have a compact license, then they have to get an Alaska license or a New York license or a California license. So we have nurses that are licensed in all 50 states, because wherever you sit, George, so if you're on vacation and you're in Alaska, a nurse with an Alaska license must be the person who helps you. So that it does take a lot of work, a lot of effort on our nurses to make sure that we're licensed in all the states where we could be receiving calls from.
So that's certainly an interesting thing and not surprising that some states would have some kind of reciprocity or compact, as you said. So what have been the really challenging things of getting Conduit going, if not regulatory and if not the money piece?
Yeah, the challenging thing is, and I won't say it's challenging in every situation, because there are a lot of folks who immediately see the value. However, there's the opportunity to say, having a physician on call, that's fine. We don't need anybody to help. We don't need anybody, doing this. Can you exist without it? Absolutely.
Sure.
Um, and so helping those who don't inherently see the value, understanding the value. And for those who've ever experienced nurse triage, they immediately go, oh yeah. When we first launched Conduit, we started it for Bon Secours Mercy Health first. So we were answering for the needs of our parent organization that we're a spinoff from. So you should have heard the doctors and nurses scream when they heard that part of the benefit plan was to call nurse triage first before going to the emergency department, because for non-emergent conditions. So if you have crushing chest pain, numbness, or you go straight to the ER. Just go to the ER. But if you're like, my ear hurts, I have a sore throat, call us first and we'll help you. And so at first it was like, well, I'm a nurse. I don't need anybody to tell me whether I need to go, or I'm a doctor. I don't need anyone to tell me that I need to do this or that. But what we found within a couple of weeks is that these same individuals, it was like crickets, because they were like, oh, you helped me. You got me in to see somebody really quick, or you told me that I could do this, or you helped me navigate to a pharmacy to get what I needed. And so recognizing nurse triage not as an impediment to getting the care I need, but a facilitator to getting the care I need. So I think that was a beginning kind of hurdle, but was quickly, resolved.
Yeah. Well, I think that you've named your company really a wonderfully appropriate name. Certainly,
Yeah.
you're a conduit to getting the care and attention and resources that you need when I don't speak the language or understand the complexity and I don't feel good and it's freaking me out.
Yeah. Yeah.
Is that a
And
technical term? Is that a medical term, freaking out?
freaking out. Yeah. Nurses hear it all the time. So, and one of the things that we look for and we interview and hire for, you can be an amazing nurse, but not really good for this job,
Hmm.
because you have to be able to convey compassion and caring and patience and good listening skills. And everybody doesn't. I mean, I can snatch you from the jaws of death, but can I listen calmly to you, and hear you out and make you feel safe? So that's really what we look for and we hire for in our nurses, in addition to strong clinical skills.
I don't imagine that that's really easy. Those are big skills.
Yeah, yeah. And we actually have all of our nurses come and shadow. Like, they stay for about 4 hours, they listen on the phones, they hear what they're going to be doing, because it's one thing to work bedside and be touching and feeling and doing things with folks. It's another thing to be able to hear and pick up on, oh, I can hear them struggling, or I could hear, this in the background. So I mean, we get involved in a lot of things, and I'll tell you, George, one thing that I've really been struck by in the years, almost 8 years now that Conduit has been in existence, is the epidemic of loneliness that is really prevalent in our country. We have callers sometimes that are just calling because they're lonely.
Hmm.
And I'm proud that our team is really compassionate and able to help in those situations, and really sometimes help people get to the kind of resources that they need, not only for physical ailments, but also mental health needs that folks may have.
Here I'm thinking about how to deal with my kid's ear infection when in fact there's a whole nother world of emotional and psychological and mental illness that you are addressing as well.
Yeah, yeah. It's really broad ranging, and one of the things that, again, thinking about the kinds of nurses that work for us, is you don't know. It's really like being in the ER. You don't know what that next call is going to be. It could be, a young parent concerned about a baby. It could be, a college age student. We've helped with school projects. It could be someone suffering from depression and suicidal ideation. It could be someone with crushing chest pain. You just don't know. And so, being there to assist, and we use protocols. It's not just nurses making this stuff up off the top of their head. We use what's called the Schmidt-Thompson clinical content protocols. So we have very well vetted protocols that we walk down, that we make sure that we're asking the right questions, and that we're looking for the right kind of symptoms and the right kind of referrals, that's based on really strong data and medical knowledge.
I imagine there is a massive amount of documentation that goes on your end and all of that kind of stuff, which is certainly cumbersome, but obviously essential.
Yeah, yeah. Well, and we, we want to provide this documentation and the data to our clients because if I'm working with a federally qualified healthcare center, that's a lot to say in one word. But if I'm working with an FQHC, then they need to understand what kinds of calls are we getting? Are
Hmm.
they a lot of behavioral health, or are they a lot of pediatric, or are they a lot of this? Because I need to adjust maybe my strategies, my community outreach, based on the kinds of needs that are being expressed from the community that I'm serving. So we really like to give data. Data tells a lot and to our clients and helps us help them plan to really address needs in the community. And at the end of the day, then that's what Conduit was meant to do, is help not just in the moment, but to help our clients make longer range plans to improve the health of the communities that they're serving.
I wish I were a health planner, a health provider, because the light bulbs just keep turning on for me. Cheryl, I totally get it. You are in a lot of ways the first responder, the front end, the welcoming center for these organizations, patients, clients, customers, however they like to think about it. And you are doing all of those things. You're telling them, hey, we need to do some more literacy and education on how to be a better consumer of healthcare. We are saving you a ton of money. We
Mhm.
are we are doing all of these things and showing you these metrics. And so I imagine that these are all benefits that maybe people didn't think about or realize that they're receiving from working with your organization.
Yeah, yeah. And we're just trying to, again, get the word out to healthcare organizations and those who really are trying to serve their communities. We actually are also partnering with an organization called Nurse Disrupted that has kiosks, healthcare kiosks in homeless shelters.
Hmm.
And we serve the homeless virtually. So just like you and I are looking at each other right now, if you were in one of these, if you were experiencing homelessness and in one of these shelters, you could tap the button. One of our nurses will come up and help you, talk through what your healthcare need is for you or your children, whatever situation you're in.
Fascinating.
Yeah.
Well, Cheryl, thank you so much for coming on. Thank you for the work that you're doing. Where can people learn more? How can people get involved?
Yeah, www.conduithp.com. And we would love to help any organization that's looking to really make a difference and an impact in their community around access and understanding what the needs are for those that they're serving.
Love it. Well, if you enjoyed as much as I did, show Cheryl your appreciation. Share today's show with a friend that also appreciates good ideas. Go to conduithp.com, CONDUITHP.com, and check out everything that Cheryl and I have been talking about, plus so much more. Thanks again, Cheryl.
Thank you so much, George.
Until next time, remember, do your part by doing your best.